This dog came to me on emergency and his foot was swollen. We really didn't know why. So I immediately started to use lymphatic therapy with our machine and laser to bring down the swelling and to move all that edema up the leg. So this foot was dying. And we continued using all of our lymphatic work and hyperbaric oxygen and ozone. And it got really ugly at the 1 week mark. And then we started to see the healing just a couple of days later. And this thing rapidly started to heal until we literally had full resolution.
So welcome everybody. It's Richard Flute guiding Healing Energetically. And what we're doing today, we're going to be talking to the absolutely amazing, wonderful Dr. Marlene Siegel, who, I mean, honestly, just love Dr. Marlene Siegel. Love you, Marlene. You know that. We're friends. Marlene's even spent some time in my house, and I've been to hers and her house, and we spent time with your daughter. And Dr. Marlene is a veterinary surgeon. And really the whole point behind today is to understand the whole idea and the ideology behind energetics. And in the book, I talk about energy. We talk about water. We talk about mitochondria. We talk about melanin. But people go, oh, no, that's not real. It doesn't really. I can't handle it. And I got cancer, and I need chemo, and I need radio, and you know, this is how people look at it. Yet here we have animals who can't sit down with a whiskey and a cigarette and go, oh, well, Dr. Marlene, it hurts just here. They can't do that. So what I want to show you is, well, actually, Marlene's going to show you. It's stuff that will blow your mind as to what is possible when we look at healing in an energetic way. So over to you, Marlene. Over to you. Enough about me.
So let's define bioregulatory medicine, because I've taken that on as more of what I actually do. And in real simple terms, it just simply means we're looking at the root cause of the problem. We're really understanding the biology of the body so that we can support the body. We don't heal anything. We allow the body to do its magnificent intelligence and its innate intelligence, and we support the body to do the healing. So that's what bioregulatory medicine is. And we've kind of gotten into the slump of survival, and we think that surviving is good enough, and it's not. So this presentation is to help you understand how we can go from surviving to thriving. And we have this big polarization going on in our world. You know, it's all my way or it's all that way. And everybody has their arguments. And really, it's all about perspective. So when we are looking from the left, the guy sees a 6. She sees a 9. They really see what they see. And so what if we could take this whole expanse of medicine, the allopathic, the Western, the Eastern, all of that, and what if we could make it an and we could take the best of both worlds? Because with that expanded toolkit, we have an opportunity to really do the best for ourselves and our pets, which is my focus. And then the last myth I want to help everybody with is, how old should pets be? Because people come into my clinic and they go, oh, my animal is 12 or 14 years old or 18 years old, and they think that is ancient. Well, it is in today's age, but it shouldn't be. This is Cream Puff. She was in the World Guinness Book of Record in 2010, 38 years and 3 days. And the same plumber in Texas had a cat that was 34. Maggie from Australia, 30 years. And then Bobby just passed away at 32. So despite the fact that we have a pill for every ill and a diet for every disease in our Western world, we're seeing cancer rates the highest we've ever seen in our pets. Dogs outbeat humans. 1 out of 1.65 dogs getting cancer. That's literally almost 100% of dogs coming down with cancer. Age irrelevant. This is animals under the age of 4 getting cancer. Cats, they say 1 out of 3. I think it's highly underreported. And then if we add obesity, autoimmune disease, arthritis, allergies, gastrointestinal diseases, I probably hit 99% of the pet owners out there going, oh, my pet has one of those. You know, it's almost 100% of animals getting disease, and they're living 7 years shorter than they did 20 years ago. And about 24 years ago is when glyphosate came on the market. So not a surprise, which leads us to, I'm going to simplify medicine for everybody. We either have a deficiency of essential nutrients. These are the nutrients that the body needs in order to perform properly. And we have to get them from our diet. We have to eat them because the body can't produce them in sufficient quantities. Toxicity or excess. This is where we've overloaded the body with so many toxins that it just can't get rid of them. It can't deal with it. And it's almost always a combination of deficiency with toxicity. And then we have mitochondrial dysfunction, which is a consequence of this. And last but not least, the part that Richard and I love the most, which is the emotional component that's involved with all dis-ease. This is my 6 steps to healing. And honestly, if you just did this, you would change the life of your pet and yourself. Easy steps. Number 1, we got to stop doing the things that are causing the disease. So we have to feed a species appropriate diet to our pets. That is a raw diet, not processed foods. They have to have clean, structured water, which is a big topic for Richard and I. They have to minimize the toxins in the household. They have to minimize the EMF. They have to minimize the ants in our owners' brains. Those are the automatic negative thoughts. Because when we are thinking negative thoughts as our pet parent, we're producing these neurochemicals that then entrain to our pet. So our pet's just going, wow, my owner is really stressed. There's some horrible thing about to happen. I can feel it energetically. I don't know what it is, but I'm going to stay in a sympathetic tone because danger is on the way. And so being able to help our pet parents get rid of those automatic negative thoughts and understand them and process them, which is Richard's magic, that's really, really important. And then step number 2, we mentioned all the essential nutrients that the body needs to have. Number 3, we have to heal the leaky gut. Number 4 is detoxification. And we talk about the 6 organs of elimination: the kidney, the colon, the lungs, the liver, the skin. And I now include within the lymphatics, the fascia, because the lymph actually runs through the fascia. And we're really starting to understand the importance of fascia. Number 5, mitochondria. That's where all of our power comes from, all of our energy. But the mitochondria also communicate with our microbiome. So when they are dysfunctional, they are not giving the signals that allow the body to know what it needs to do. And then number 6 is clearing the trapped emotions. So a lot of people go, well, I've been practicing veterinary medicine for 40 years and about 25 of it now in integrative medicine. And there's always an impetus in our lives. There's always something that happens that makes us step up to the plate. It makes us do a trajectory change in your life that you need to do, but maybe you weren't willing to do it yet. And mine was this horse, Lily, and my youngest daughter, Demi. And they were not just best friends. They were amazing in the show ring. They were almost undefeated at the local, regional, and national levels. And then there was a show where something went very, very wrong. Lily reared in the air. This is not a picture of Lily and Demi, but this is an example. No one taught my daughter that if your horse rears in the air, you need to bail off and get to safety, because the number 1 cause of a rider's death is a horse falling over and crushing their rider. I had a 50-pound child and a 2,000-pound horse. My daughter, in trying not to fall off at 10 years of age, she's literally hanging and dangling from the reins, and her body weight was literally pulling Lily over backwards. This horse, as she's being pulled over backwards, squats on her left hind leg, Demi was falling to the left, and pushed herself as hard as she could as she's being pulled over backwards to the right. But when she hit the ground, you couldn't see space between my daughter and the horse. Lily caught her breath and got up. Meanwhile, I'm jumping over the railing, running to my daughter, who isn't moving. So when I got there, by the grace of God, Demi was fine. She only hurt her pride. But back at home, the problem wasn't done. We had equine veterinarians come out because Lily was still having problems. And they said, Dr. Siegel, I don't really know what to tell you. We don't know exactly what's wrong, but here is number 1, she's not safe to ride. She'll never be shown again. And number 2, you can put her out to a pasture for the rest of her life. She's 7 years old. Or you can put her down. And it was those words, there's nothing more that can be done concept that was said to me that was my trigger. That was the impetus that said, no, I am not willing to accept that. There has to be more answers. And I don't blame you guys for not knowing, but I'm going to seek other answers. And that's what started me on my journey. And I was absolutely dedicated, committed 100%. And I also made a commitment that I would never ever, ever tell a pet parent when they came to me that there was nothing more that I could do. I was going to find more to do no matter what it took. And that's why my clinic now has the most extensive integrative practice in the entire world, because I don't care what it costs. I'm going to get it if it's going to help. 5 months later, this little dynamic duo went on to win the United States Youth Reserve National Championship. So when I tell you, don't let someone else define you. No one can give you limitations, and don't give them to yourself. Always be willing to seek and expand and search and be willing to try things. You know, it's not about living forever. It's about living with quality of life while we're still here. And by the way, Lily is still in my backyard. All right. So Richard, you want to pop back in and we'll talk a little bit about cancer or the C word?
Yeah, absolutely. I think that we need to just pre-frame this and just say these are animals, and that if you are a human and you are looking at cancer, you do need to get a diagnosis. We got to do all that sort of stuff, and that understand that this is no substitute for a medical diagnosis. Blah blah blah. I'm sure you come across all of this information every single time. We're looking at animals. And I think the main thing that we want to say here is, and that just the story I think earlier on says everything, that I'm going to say this very briefly, is your medical doctor is fantastic. We have, both Marlene and myself have numerous medical doctor friends, and we just need to understand that their model is a great model, and that there are other models which they don't know about. And I think that's the best way to look at it. And what you're going to see here are models that they just haven't even seen. Even your vet is under the same type of thing. And what you're about to see, it'll bring tears to your eyes, unless you're not human. So, okay, over to you, Molly.
So this was Wiser, 14 years old, came to me for limping. So never, ever, ever restrict your doctor from getting a good diagnosis. This is the beauty of the Western world, is we have these technologies. This was an X-ray. So the dog came in for limping, no coughing. We took an X-ray of the shoulder and we saw a chest full of cancer. So all those lumps and bumps in the chest, that's all metastatic cancer. And yet the owner wasn't willing to give up. She wanted to do everything she could to extend quality of life for this dog, which we did. We went through our 6-step principles. We cleaned up the diet, used the right supplements, and this dog lived another year. Here she is in the salt booth with her mommy. And she lived an entire year longer with 100% quality of life. And this owner was so grateful to have that extended time. So the very first thing that we want to talk about in our treatment protocols is getting into a parasympathetic state. So we have an autonomic nervous system, and this is described well in Richard's book. And the autonomic nervous system has 2 branches. When they're in balance, they're right here. But when one side is stimulated, like a teeter-totter, one side gets turned on, the other side gets turned off. And one side is your sympathetic. That is your fight, your flight. That's the side that if there's danger, you're releasing cortisol, you're getting blood to your muscles, so you can either run really hard or you can fight really hard and try to save your life. Once the danger is gone, if you have survived, then your parasympathetic side is the rest, repair, digest, detoxify, and reproduction side. So obviously, if you're running for your life, you're not going to be hungry. You're not going to care if you have to go potty. These are just not things that are important at that moment. But what happens in our day-to-day world is our bodies have become so accustomed to be in fight flight that they don't realize there's not a saber-toothed tiger chasing us, but it's our credit card, our debt, it's our spouse fights, it's our children's stress, it's our work stress, it's the processed food, it's the EMF. All of these things are contributing to this really high sympathetic tone. And we're running, not realizing our body's in a state where it can't repair and regenerate. So the first thing that we do with our patients is we get them into a parasympathetic state. This machine is called a magnosphere, and it is as simple as we sit inside the magnosphere, and they're in training to these low picotesla frequencies that train the body to come back into a parasympathetic state. We can actually put our individuals into a theta brainwave, which is a great state for being able to reprogram trapped emotions. So here's a little example that I want to play for you. This is Chirp. Chirp is 25 years old in this picture. He originally came to me when he was a baby. He had split his lower beak on a wire in his cage. And they took him to an emergency center and they said, you can't repair the beak. He's never going to be able to survive because he can't eat. And so you just need to euthanize him. Well, they weren't willing to do that. So they came to me and we just started working with Chirp, and his beak would overgrow because it wasn't properly positioned against the lower part that was still fractured. But for 25 years, we just trimmed his beak and he figured out how to eat and obviously doing very well. But he was also a very little frustrated bird. So listen carefully to the sounds that he's making. He is angry.
Right, we just started playing the music.
But I'm using a frequency music that is going to help him to relax. And I won't play the whole video, but his dad ends up putting him back in because he keeps fighting him. Now, 3 minutes into the music, I'm able to trim his beak. And now listen to his noises. He's cooing at me. He's putting his head down. He wants me to pet. He's lifting his wing so I can pet underneath his wing. That's the change of going from high sympathetic tone when he came in to parasympathetic. He's just loving on me. And I'm not his favorite person usually because I'm the one trimming his beak, but that is pretty profound. And here's another one. This was a dog. He's only 6 months old. He came in because he was not acting right. And we had taken x-rays and saw, I'll show you the x-rays at the end, that his back was really out of alignment. And so I'm trying to adjust him, and you can just see he's already a hyper dog and he just won't hold still. So we play the frequency music. We're about 3 minutes in. He is already laid down on his own. His owner is not holding him. Watch his eyes. His eyes are getting heavy. He's like blinking. He's trying to stay alert. He's hearing noises around him, but he just can't really manage. He gives a big yawn. Another couple seconds, he puts his head down. Again, this is the power of being in parasympathetic. You just saw him in high sympathetic tone. Now, question is, can I adjust him? We continue playing the frequencies, and he allows me to do his adjustment. She's not holding him. We're not restraining him, and he's staying in that parasympathetic state. Amazing, right? This is his x-ray. So on the left, you can see his back looks like an inchworm. It's kind of teed up in the center. And then after we adjusted him and he went into a parasympathetic state, his back straightened out. And of course, he was back to normal. So this case was a little dog that had gotten very severe diarrhea. She went to an emergency center, which was a board certified referral place. And they did a little bit of blood work and they found that the liver enzymes were really, really high. Well, they treated the diarrhea, but they told the lady that the dog has liver disease and she needed to find a vet and it wasn't going to do well. So 5 months later, he comes to me, and this is live blood. So let me explain a little bit on what live blood is. We take a drop of blood, we put it on a microscope slide. We don't stain it with anything, and we look under high power. All the big balls that are in there are red blood cells, and their job is to pick up oxygen from the lungs through their surface area, deliver that to the tissue, and then they pick up waste material from the tissue and they deliver it out the body. So, first they're delivering oxygen, then they're being the garbage disposal for all the toxins that the cells produce. And because the cells are supposed to use their surface area, they're supposed to be separated. Well, interestingly, when I was in veterinary school, they told us that this condition, which is called rouleau, that's a French word, isn't it, Richard? Rouleau.
Yes.
They said that was normal in horses and cats. It is not normal in any species, and I can prove it because we can make it go away. But irregardless, this dog came in with severe rouleau. I'm going to actually play the video, and you can see that the cells are not moving very well. They're all clumped together. They're certainly not able to do their metabolic function very well, and all that stuff in the background is fat. This dog had already been fasted for 7 hours and still had all this fat in the blood, which is not normal. So we did blood work on him, and we saw that he had really high triglycerides. His triglycerides were 2,515, which is extraordinarily high for any species, but really high for a dog. And then this was after one treatment, 1 hour in that parasympathetic magnosphere state. And look at what it did to that fourth phase of water. It's caused the fourth phase of water to expand, which then changed the polarity of the cells, allowing them to separate. Now, look how pretty they look. This is 1 hour in the magnosphere. We've made a massive amount of change. We have less fat in the background because we've started this dog on some digestive enzymes. And then this is the third treatment. This is day 3 in a row. Notice that all the fat is gone in the background, and look at how these cells are flowing. They have life, they have energy, they're happy. We did blood work on this dog 1 week later, and his triglycerides with no drugs, just a change in diet and getting him into a parasympathetic state, went down to normal at 125. So on the left was before we treated him, on the right was 3 days later. It's just absolutely remarkable.
Can I say a comment about dark field microscopy? Because
yeah, this was light field, but I did light field, but dark field is the counterpart, which is fabulous.
And you know what? It's just looking at real live blood cells. I just want to say something. Medical doctors are not allowed to look at live blood. Did you know that? They're not allowed.
I did not know that.
Oh, yes, they're not allowed. It's not allowed by law. And also dark field microscopy. And I think even light field in humans is also banned in certain countries. Why? I mean, it's just a very useful way of being able to see what's going on. So I know people will be looking at, oh, I need to get some of that. Just be aware you may have some challenges. That's it.
Yeah. And I'll kind of add on to that. I don't do, there's a lot of people that do what they call nutritional microscopy, and they make a lot of interpretations about what nutrients you're deficient in. That's where you really get into trouble. I keep it really simple. What is the fourth phase of water doing? Because when the fourth phase of water is expanded, and that's scientifically proven, then the body can function well because you're looking at it. You're literally looking at the cells and the changes it makes. And so metabolically, the body can function. But when that phase is collapsed, then it doesn't work well. So that's how I use it. It's just a marker for me to know where I'm at.
That we just need to explain what that fourth phase of water is briefly. There's water has, we're taught 3 states, but there is one more. And that's a sort of like a jelly-like state that's been well researched. Fourth phase of water, Dr. Gerald Pollack. You can actually get a book. I talk about it all the time in the book. Anyway, over to you again, Marlene.
Yeah, you very well described it in the book. So that would be definitely something you want to pay attention to. Now we're getting into light therapy, and we are literally energetic beings, and we are light beings. We need light in order for our bodies to work. Our mitochondria literally use red light and infrared light and UV light to function. But we are in a world where we are light deficient because we're indoors all the time. We're under artificial lighting. We're not outside in the full spectrum of sun from early morning to the end of day. And so we're really struggling with our metabolic health as a consequence. So this is called a Weber laser, and it can be used intravenously. So you put in a regular 22 gauge catheter into the vein, like most people are familiar with, and then there's a little fiber optic that can thread through that catheter literally into your vein. So I'm on the right getting a therapy, and I'm getting red light therapy. So you can actually see the red light coming through my skin. And that catheter is in my skin, and Alyssa's getting, I think she's on the ultraviolet light on the left. And then we have a handheld laser, which we can use externally as well. And what's important about photodynamic therapy, which is using a photoactivator, natural compounds, like it could be curcumin or mistletoe or vitamin C, all these different natural compounds are activated by light, different wavelengths of light. And so we use this as our primary tool in our therapies. And the reason is because with photodynamic therapy, we're able to affect pathogens across the board: fungi, bacteria, parasites, and viruses, where antibiotics only treat bacteria. And what's even more frightening is that we will only have antibiotics for probably less than 20 years, maybe 15 even, because the rate of antibiotic resistance is becoming so high that we are running out of antibiotics that actually work. And these bacteria are mutating and finding ways to get around it. So with photodynamic therapy, it's safe, it's effective, and there's no resistance. Very cool. So let's show you an example of how we use photodynamic therapy. This was Tucker. He was 4 years old, Great Pyrenees, that came to me. He was limping, so they went to the vet, and their vet took an x-ray. He was correctly diagnosed with osteosarcoma, which is a bone cancer, and he couldn't use his left leg. He was so painful on it. We started our therapy. The blue arrow is showing you the hole that was in the bone. That's the cancer eating away. And then if you look right above the hole, you can see a little like dome arch and some fluffy bone above that. That's all of the periosteal reaction, the bone reaction from the cancer that's eating the bone away. So we continued our therapies. Here he is getting photodynamic therapy. And Tucker was the very first dog in the entire United States to receive photodynamic therapy. So he's getting all of his rainbow colors. And 10 months later, the radiologist confirmed that his bone cancer was resolving. So that was a wonderful case. We also use infrared because, again, the infrared is the lights that our body is understanding how to use it. And I believe in full spectrum because the sun is full spectrum. So a lot of people, they'll think that the far infrared's best, or the near infrared best, or the mid infrared. Well, they're all important. So I use technologies that give us the full spectrum, and I let the body choose what it needs to be able to do the healing process. The pad on the left is really nice because it delivers full spectrum infrared, and the animals just have to lay on it. Or we could sandwich them between two, but the point is that they're not being contained in it, and they actually go to it. As soon as I put the pad down and plugged it in, my cat ran over there and laid on it. We also have it in a sauna, and then on the right-hand side are the individual personal saunas, which are really popular. Not so popular with a pet, though. You know, you don't want to be sitting in there and sweating with a dog on your lap because they're hairy. And I don't like to put the animals in by themselves into these particular saunas because the bottom also has an infrared pad, and it gets hot. And then they're down in there. They don't want to stay in there by themselves. So for my animals, I use the pad or a full walk-in sauna. This is the part I really want to talk about, the lymphatic system. We were taught that there is a lymphatic system in veterinary school, and you've got lymph nodes, and we knew that it was part of the immune system, but we really didn't appreciate the importance of the lymphatic. And I would say that of all the 6 organs of elimination, the liver and the lymphatics are the 2 most important. So we use a particular machine. You can see in the middle picture and the left picture, well, all of them, you can see the glass probes. And this machine is producing a microcurrent with negative ions and inert gases, one of them being ozone, to be able to thin the lymph, get it to where it can flow again. And we can adjust the settings of this machine so we can go all the way down into the abdomen and be able to work the lymphatic that's deep inside the abdomen, where the manual techniques just don't have that capability. And this is non-invasive. The animals love it. You can see a cat right in the middle, laying on its back in a trough, enjoying the therapy. So we boost the immune system. We aid in detoxification when we're doing lymphatics. Of course, that's just the tip of the iceberg. And I want to show you an example, a couple of examples of how important lymphatics is. This was Popcorn. He is a VIP, a very important pet. He is a service dog. He warns his mom when her blood sugar gets low. So he travels with her everywhere, but he was having chronic vomiting, chronic diarrhea, days on where he wouldn't eat and just feeling miserable. This is his live blood on the left before we did lymphatic therapy. You can see the rouleau, a lot of clumping of cells, and on the right was immediately following his lymphatic therapy. So this example is to show how important that it is to move our lymph. And many different things will expand that fourth phase of water. This is the energy of the machine with the ions and the microcurrent that's able to do it. And what a difference. Of course, the dog immediately started having massive improvement, and he now lives an amazing quality life with a rare episode of vomiting and not eating. This is another case that we did lymphatic on. So this dog came to me on emergency and his foot was swollen. We really didn't know why. I didn't know if he was stung by something, or they started telling me that he was licking his foot, so they put a bandage on. And I kept asking, was the bandage tight around the top? And they didn't think it was, but I had my suspicion. So I immediately started to use lymphatic therapy with our machine and laser to bring down the swelling and to move all that edema up the leg. And within 2 days, we could see the tissue of the foot starting to die. And look up at the top, you can see that demarcation line. They had a restrictive bandage that literally went 360 around the leg and cut the blood supply off, cut the lymphatic supply off. So this foot was dying. And we continued using all of our lymphatic work and hyperbaric oxygen and ozone. And it got really ugly at the 1 week mark. And then we started to see the healing just a couple of days later. And this thing rapidly started to heal until we literally had full resolution. And this dog was only 2 years of age. So amputating this foot was not a good choice. And the power of being able to move that lymph and be able to restore circulation to the foot was amazing. Richard, you want to comment anything on lymphatic and fascia? Because we're going to get into fascia as well.
How many people have to have limbs removed because, say, even diabetics?
Absolutely.
What's really going on here? And there are no other solutions in traditional medicine. It's right, it's done, so we got to get rid of it. I mean, what are we doing here? Apart from just really understanding the body.
Remember, that healing all occurred within a matter of a couple weeks.
Incredible.
In part 2, Marlene shows other energetic approaches like ozone or sound frequencies, where she shows cases of how she's helped animals heal. The link's below.